My name is Glen Hatcher. I'm a diagnostic radiologist from East Tennessee. I was born in Tennessee and trained in Alabama and vacationed in South Carolina. So I rarely ever leave the South. The South is wonderful because, well, it's home. We have sugary donuts, we eat fried food, and we fry everything. I was actually in medical school. I had some nosebleeds and sinusitis, and over a period of months that became apparent that it wasn't something minor. There was a blood test that was able to diagnose that I had Wegener's granulomatosis.
Glen's a great guy. Unfortunately, as part of his disease process, he developed a narrowing or a stricture of what's called the larynx in the upper part of his trachea or windpipe.
Unfortunately, there are complications, one of which is a narrowing in the subglottic larynx, and that narrowing can be fatal.
Tracheotomy is an option, but he's a practicing radiologist, and let's face it, nobody wants a hole in their neck if they can avoid it.
I was progressively having more and more difficulty with exertion, and to the point where I was having trouble going up 1 or 2 flights of stairs.
You cut the airway in half, you lose 15/16 of your minute ventilation, assuming everything else is constant.
When I knew that I was in trouble, I was having shortness of breath with no activity at all.
There's a myriad of rare diseases that can affect breathing, and ultimately, my practice is about keeping people breathing. I say publicly when I lecture that breathing is not overrated.
And so then it was just a matter of finding some way to treat it, which isn't that easy to do because you have to breathe while the surgery is going on.
So you have somebody who can't breathe to begin with, who's got complicated medical issues in the background, who's now being paralyzed by an anesthesiologist who's not intubating the patient, which is what they're trained to do. So now you have a potential for a disaster. You've got to be very vigilant.
So that's why I needed help from an ear, nose, and throat doctor. And there weren't very many ear, nose, and throat doctors that have dealt with this problem. And I began to go to different tertiary centers, such as Duke and Mayo, and to call numerous other ear, nose, and throat specialists, and combined with the knowledge that I got from those experiences and my own research, I was able to find Dr. Lebovics.